So patients who have stones in their gallbladder, they don't always have symptoms, right? And their pain, they sometimes might experience pain, and their pain is sometimes going to be there and sometimes not. So this is a gallstone. Let's say that this is a gallstone. When a gallstone is present in our gallbladder, it is going to be called cholelithiasis, right? And the pain, as we talked about, is not always going to be there. Now, when someone eats a fatty food, what is going to happen is fats and lipids are going to enter our duodenum. And in our duodenum, we have these eye cells. And these eye cells, they're going to produce cholecystokinin, or CCK. What the CCK does is it is going to contract our gallbladder to release bile. There's also a sphincter in our intestines called the sphincter of Oddi that is going to relax at the same time. So CCK is going to contract our gallbladder, and it is also going to relax that sphincter of Oddi so bile can move into our intestines. Now, if a patient has stone in their gallbladder, what can happen is when the gallbladder is being contracted, it can move into the cystic duct, which is found over here. If the stone moves into the cystic duct, it is going to result in persistent pain. And this can cause cholecystitis, which is basically an inflammation of the cystic duct and everything behind it. Now, remember, the flow of bile is from the liver and is going to travel to the intestines. So if the stone is in our cystic duct, then bile can still flow to the intestines, right? So there's not going to be a backflow of the bile. Now, if that stone moves into our common bile duct, let's say that this stone moves into our common bile duct, what can happen is bile is not going to be able to move into the intestines, so that bile is going to back up, and then it is going to back up into our liver. Then it is going to travel through our hepatic vein into the systemic circulation, and this is going to cause jaundice. When we have stone in our common bile duct, this is referred to as Choledocolithiasis. Choledocolithiasis. Now, when we have this stone in our common bile duct, it is going to create this closed system. And this closed system is going to be very prone to infections. And if we get this location affected, that is going to result in cholangitis. And this could be deadly. The patient can go into shock and ultimately die. So it is extremely important that the patient is promptly treated if they have choledocolithiasis. And a patient will present with jaundice if they have choledocolithiasis, because as we talked about, that bile is not going to be able to flow into the intestines, then it is going to back up into the liver, and then it is going to travel and reach our systemic circulation through the hepatic wing.